In Western Europe, some governments have openly recognized hazards of fluoride, and only 3% of the Western European population drinks fluoridated water. According to the most recent statistics, in the United States, over 72% of Americans are drinking fluoridated water. Source of U.S. fluoridation statistics, Centers for Disease Control and Prevention, Water Fluoridation Data and Statistics, page last reviewed January 13, 2020. Neither the Environmental Protection Agency nor the federal government mandate water fluoridation in America, and the decision to fluoridate community water is made by the state or local municipality. However, the U.S. Public Health Service establishes recommended fluoride concentrations in community drinking water for those who choose to fluoridate, and the Environmental Protection Agency sets contaminant levels for public drinking water. After water fluoridation in Grand Rapids, Michigan began in 1945, the practice spread to locales across the country in the decades that followed. These efforts were encouraged by the Public Health Service in the 1950s, and in 1962 the Public Health Service issued standards for fluoride in drinking water that would stand for 50 years. They stated that fluoride would prevent dental caries, and the optimal levels of fluoride added to drinking water should range between 0.7 and 1.2 milligrams per liter. However, the PHS lowered this recommendation to the single level of 0.7 milligrams per liter in 2015 due to an increase in dental fluorosis and to the increase in sources of fluoride exposure to Americans. Meanwhile, the Safe Drinking Water Act was established in 1974 to protect the quality of American drinking water, and it authorized the EPA to regulate public drinking water. Because of this legislation, the EPA can set enforceable maximum contaminant levels, MCLs, for drinking water, as well as non-enforceable maximum contaminant level goals and non-enforceable drinking water standards of secondary maximum contaminant levels, SMCLs. The EPA specifies that the MCLG is, quote, the maximum level of a contaminant in drinking water at which no known or anticipated adverse effect on the health of persons would occur, allowing an adequate margin of safety, end quote. Additionally, the EPA qualifies that community water systems exceeding the MCL for fluoride, quote, must notify persons served by that system as soon as practical, but no later than 30 days after the system learns of the violation, end quote. The source of this information came from the EPA's web pages about drinking water contaminants and fluoride. Moreover, the Toxic Substances Control Act of 1976, also nicknamed TSCA, authorized the EPA to prohibit the particular use of a chemical that presents an unreasonable risk to the general public or susceptible subpopulations. On November 22, 2016, the Fluoride Action Network, along with 5 other organizations, including the IAOMT and 5 individuals, presented a citizens petition under Section 21 of TSCA to the EPA. The petition requested the EPA to exercise its authority to prohibit the purposeful addition of fluoridation chemicals to U.S. water supplies on the grounds that a large body of animal, cellular, and human research showed that fluoride was neurotoxic at doses within the range now seen in fluoridated communities.